Hello. Today we will be discussing medications for the lung. Our objectives for this presentation will be to discuss the do's and don'ts of taking your medication, to help you understand the uses and common side effects of your lung medications, and to know what you should be discussing with your doctor. Just so you know, this presentation is intended for informational purposes only and is not all-inclusive, nor should it be interpreted as medical advice. You should consult a qualified healthcare provider before making any decisions about your therapies and/or health conditions. So what are the do's of taking medications? Make sure you do know about your medications, names, what they're used for, etc. Do take your medications as prescribed. Do refill your medications before they run out. And do keep an updated list of your medications with you at all times. The don'ts of taking medications are as follows. Don't stop taking your medications without talking to your doctor. Don't hesitate to make sure you have the correct medications filled by your pharmacy. And don't share your medications with others at any time. Some common medical terminology you may hear when talking with your healthcare provider about your lung medications might be bronchodilators, which may be short-acting, lasting 4 to 6 hours, or long-acting, lasting around 12 hours. Corticosteroids, anti-inflammatory medication. SOB, or shortness of breath. Exacerbation, which means a flare-up. And the word histamines, which are hormones that cause allergic reactions. Pictured here are many different types of inhalation devices. It is important to discuss with your healthcare provider about how to use your prescribed inhalation device. There are several classes of lung medications that you may hear your doctor mention when choosing an appropriate treatment for you. There are beta-2 agonists, anticholinergics, corticosteroids, and a combination of beta-2 and anticholinergic, or a combination of beta-2 corticosteroid, mast cell stabilizers, phosphodiesterase 4 inhibitors, and leukotriene inhibitors. In the next several slides, we'll discuss each class a little more in depth, providing examples of medications and common side effects. Beta-2 agonists and anticholinergics are two types of bronchodilators. They cause relaxation of the muscle that lines the airway. Beta-2 agonists can be either short-acting or long-acting. Short-acting beta-2 agonists are used as rescue inhalers or used when you need to catch a breath. They work within 3 to 5 minutes and usually last for 4 to 6 hours. Long-acting beta-2 agonists are used as maintenance medications. They take at least 20 minutes to start working, but usually last 12 to 24 hours, so they're taken just once or twice daily. The most commonly prescribed short-acting beta-2 agonist is albuterol, which you may know as ProAir, Ventolin, or Proventil. Some examples of long-acting beta-2 agonists are aformoterol, or Brovana, or formoterol, Fordil, or Perforomist. Common side effects seen from this class are increased heart rate, feeling shaky or jittery, and they may keep you awake at night if taken before bed. The side effects typically last only a few minutes after taking the medication. These side effects may go away completely after a few days of taking the medication, but if they do not go away or they worsen, definitely talk to your doctor. Moving on to anticholinergics, remember they are also considered bronchodilators along with the beta-2 agonists. They, however, have a slower onset than the beta-2 agonists. They are also broken down into short-acting and long-acting. Short-acting anticholinergics work within 15 minutes and last 6 to 8 hours, so they're taken up to 4 times a day. Long-acting anticholinergics take at least 20 minutes to work, but last 12 to 24 hours and are taken 1 to 2 times daily. They should never be used alone as a rescue medication due to their delayed onset. Only when used in combination with a beta-2 agonist can they be safely used as a rescue inhaler. Examples of combination products are Combivent and Duoneb. The following are examples of short-acting and long-acting anticholinergics. Anticholinergics have less side effects than beta-2 agonists. The most common side effects are dry mouth and upper respiratory tract infections. Corticosteroids are responsible for reducing inflammation in the airway. They can be taken in the form of an inhaler, often in combination with a bronchodilator, but oral steroids may be used during an exacerbation because they work quicker than inhaled steroids and be given in higher doses. Inhaled steroids can take up to 1 week to feel the benefit. On this slide, you will see examples of both oral steroids and inhaled steroids. Side effects can depend on your dose, length of use, and the form in which the medication is taken. Common side effects of inhaled steroids are sore throat, hoarse voice, thrush or yeast infection in the mouth. To help avoid some of these side effects, be sure to swish and spit with water after each use, and use a spacer device when using any metered dose inhalers. Prolonged use of oral steroids may cause more significant effects such as bruising, weight gain, weakening of skin and bones, cataracts, high blood pressure, type 2 diabetes, mood changes, or changes in your dental health. Earlier, we discussed beta-2 agonists and anticholinergics. These two classes may be used in combination. The following medications listed are examples of bronchodilator combinations. This slide shows examples of products that are bronchodilator and steroid combinations. There is also a class of pulmonary medications called mast cell stabilizers. When we talk about mast cells, we're referring to a type of white blood cell that plays a role in our body's response to allergens. Mast cells are responsible for releasing histamine. Mast cell stabilizers prevent the mast cells from releasing histamine. An example of a mast cell stabilizer is cromolyn. Another class of pulmonary medications is phosphodiesterase 4 inhibitors. This class has an anti-inflammatory effect and is used to treat severe COPD or chronic obstructive pulmonary disease. Currently, Daliresp, foflumilast, is the only medication on the market in this class. It is not indicated for relief of shortness of breath because it is not quick acting. There is also a class called leukotriene inhibitors. Leukotrienes are substances released from white blood cells that can cause airway constriction, increased mucus production, and swelling of the airways. These effects then lead to symptoms such as wheezing, coughing, and shortness of breath. An example of a leukotriene inhibitor is montelukast, also known as Singulair. Please be sure to contact your doctor or pharmacist if you have any questions or concerns about your medications, or if your symptoms worsen or are not improving.